So hello and welcome to this quick revision guide for psychology. So this revision guide is part of a full set of videos that are designed to help you revise and review and recap on the core ideas that you need when you're using GRAVEDS to evaluate in psychology. So GRAVEDS will help you in evaluations of psychology studies. It also helps with the evaluation of psychology research methods, but please do remember that it is not used to evaluate theories in psychology. So just use your GRAVEDS points to help with identifying and developing the strengths and weaknesses of those studies and methods. So in this short revision guide, we are going to be looking at the use of application of findings to society. So when we're talking about the application of a study, it's about how useful the findings are for wider society. So do they have a purpose? Can they be used in the real world? Do they serve some sort of useful process by which we can have better understanding and better development in particular areas of psychology? So when we're looking at the usefulness of those findings being applied to society, we can consider things like processes of therapy, informing the education system of different methods for teaching, for example, treatments for mental health conditions, policing and policing techniques, things like police interviewing, wider understanding of the reasons of people's behaviour, the effects of adverse childhood experiences, for example, and also how we can better diagnose patients with mental health conditions and so on. So for our first example, we can look at Kapovan's study where they used systematic desensitisation to treat a fear of flying. So the findings of that study was that they found that systematic desensitisation was actually successful in treating the participants' phobia of flying. It reduced their fear responses to flying overall. So this is particularly useful. It can obviously be applied to the therapy of systematic desensitisation when used to treat people for phobias, particularly of flying. Be careful with the wording of this. It's a useful study to understand that systematic desensitisation can be effective, but obviously they only studied a fear of flying. So in terms of application to other therapies using systematic desensitisation to treat other phobias, for example, a phobia of spiders, it may not have the same application in terms of finding that systematic desensitisation has a success rate. So your application here is to the treatment of the fear of flying and not beyond. So our second example comes from Rosenhan's study, Being Sane in Insane Places. So the results and findings of his study included that he found that patients were dehumanised on the wards. There was a lot of labelling in the mental health systems of 1970s USA. People were not treated positively. And as a result of this, his findings can be applied to improvements in healthcare systems, particularly mental health institutions across America and effectively beyond America, where similar dehumanisation and labelling processes take place on mental health units. So he has quite good application when you're looking at informing public policy and healthcare practices. Okay, so that brings you to the end of this quick revision guide about the use of GRAVEDS in the evaluation of studies and methods in psychology. It would be useful for you to now review all of your core studies that you've learned about across the course and check that you are happy with the way in which you've used your application to society across the strengths and weaknesses that you have given. Once you've done this, have a look at the remaining videos to help recap on the rest of GRAVEDS.